Thank you very much. It really is my pleasure to be here today. Thank you. And what a great little exercise to get started with. That was, thank you for that, for waking everybody up. So we've talked a lot about a lot of different things today about osteoarthritis in dogs and weight management, etc. What I'd like to do is drill down a little bit deeper onto some of the specifics about nutritional management of osteoarthritis. When I look around this room, some of this is actually older news for those of us that have to regularly return their hair to its natural color. I would have the wise gray in mind. Do I not do that on a regular basis? But for many of you, this may be new news, or you may not have been practicing when these studies came out. So I want to review some of the scientific evidence for nutritional management of osteoarthritis. I want to start by doing this by looking at Gabby. We've seen a lot of dogs. She's pretty typical for presenting with osteoarthritis, both her radiographic signs and that clinical signs. You can see her bunny hopping up those stairs. So my first question to you, and this on your polling question, would be if you were presented with a patient similar to Gabby, if you got a quick look at her, she's a normal body condition score. She obviously has radiographic and clinical signs of osteoarthritis. I'm not going to give you a whole lot more information than that, but what would be your first recommendation to the owner, your initial recommendation to the owner? And that's not the question. So hopefully there we go. What would be your recommendation? So it looks like NSAID's big high on that, the therapeutic arthritis food, and then supplements right in there. So kind of a split between all of those. There's no right answer to this question, and it's certainly going to depend on the individual pet that's before you as to what your specific initial recommendation is going to be. But for Gabby, she actually participated in the clinical trials when JD, Hill's Prescription Diet JD, was first brought to the market. So her initial recommendation from her veterinarian was simply a specific nutritional recommendation to change her food from her current diet to JD, and that's all that was done for her. And we can see that 4 weeks later, this is a different dog. I mean, this to me speaks volumes, that there's no change in body weight here. She was a normal body weight to begin with. We weren't having to deal with that. And without using anything else other than nutritional intervention, we were able to affect that amount of change in this dog's clinical signs. And that's remarkable to me. So what is it that we're actually doing when we make this specific nutritional recommendation for a therapeutic food to manage arthritis? Well, one of the things that we want to do is to help break that cycle of arthritis. We've already heard about this from other speakers this morning. It starts with damage to the chondrocyte. That incites the inflammatory process, which is variable at variable stages of it. But then you get that progression, which is the damage to the cartilage itself, to the matrix. And so we'd like to be able to stop that cycle everywhere we possibly can. I've already mentioned that we know the power of omega-3 fatty acids and their role in modulating inflammatory responses, so they can be very powerful anti-inflammatory, and that's actually one aspect that you are managing when you make a specific nutritional recommendation. But importantly, the other part of arthritis, this osteoarthritis in dogs, is this progression, this progressive loss of the matrix, which has to do in part with upregulation of these aggregatase enzymes, which are part of that healing process, of the normal healing process of cartilage, because your cartilage remodels itself on a regular basis. You don't have the same cartilage you were born with, and it only becomes pathologic when the breakdown of that cartilage exceeds the ability of the body to replace it, and that's what happens in these arthritic dogs, and that becomes pathologic. So what we see, and we've kind of gone through this as a histopathologic side, showing a normal cartilage with the normal dark blue matrix. The clear areas are the chondrocytes and their lacunae. You have a normal articular surface. Once you start getting damage to that and loss, increase of those aggrecanase enzymes and loss of that matrix, you no longer have that water, the blue staining stuff in there. That's what provides cartilage with its compressive and tensile strength. You start getting those shearing forces, more and more damage until you get to that bone on bone, which is obviously, we want to intervene way before that becomes where we are in this disease process. We do know that in addition to their anti-inflammatory effects from cell culture studies, that chondrocytes that are pre-incubated with varying levels of omega-3 fatty acids will be protected from releasing GAGs. That's what this chart shows, a measure of how much GAGs, or those glycosaminoglycans, are released into the cell culture upon damage. And the less GAGs that are released, the less damage then to the matrix. And you can see that particularly in the dog EPA, at the higher concentrations, you had the lowest level of GAG release. So not only are you modulating the inflammatory process, but you also have a disease modifying aspect to a nutritional recommendation as well. So you're decreasing the rate at which the cartilage is being broken down, that matrix is being lost, and perhaps that's one of the big benefits of the long-term feeding of nutritional solutions in slowing that overall progression of this disease. Because as we've said over and over, that's really the aim for all of our interventions. Prescription diet JD Canine was designed with those two things in mind, specifically to have a combination of nutrients that allow us not only to help modulate the inflammatory process, but also decrease the progressive loss of matrix and the progression of the disease. And that's great. It's wonderful to understand sort of the background at the cellular level, the pathophysiology of what's going on in these animals. But what's really important, I'm certain to all of you that are sitting out here that see cases on a day-to-day basis, is how does this perform in real homes with real clients under usual and normal circumstances, right? That's what's going to help us best predict how, when you make that recommendation to an owner, what's going to happen when they take that home and use it in their animal. And so that's what I want to spend the majority of my time with you today, is reviewing those studies that have been published looking at just that question. I want to point out that this is a fairly recent study. It was published in 2012, so it looked at evidence from prior to 2010, I believe, all of the evidence out there looking at nutritional and supplements that had been published to that point. They looked at 67 studies. Only 22 met their inclusion criteria for having enough information to do this systematic review. And only 4 of those studies actually attained the highest global strength of evidence to support the use of that intervention in dogs with osteoarthritis, clinical signs of osteoarthritis. And interestingly, all 4 of those studies were the ones that were done in support of prescription diet JD Canine, and those are the ones I'm going to describe for you now. So the first study was really a titration study to see, okay, how much, we know this works in cell culture, we know, it's going to do these good things, but how much do we have to put in the diet to see a clinical effect in the animal? And so that's what you see here, is increasing doses of dogs randomized to receive different doses of food with different amounts of the omega-3 fatty acids in them. And at the highest levels that are shown here, both for lameness and weight bearing, there were statistically significant improvements in those factors subjectively evaluated at that highest level. So good, all right. We looked at it in the cellular level in the laboratory. We thought that we would have a good response. Now we've taken it and put it into animals in different levels, and sure enough, we can find a level that is going to have a clinical effect, which is what we're aiming for. That was followed up by a multi-center study at universities looking at an objective measurement of lameness. So studies that use subjective criteria are good and are important, but they can have their limitations. This was actually using force plate analysis to dogs there were 38 dogs in the study. They were randomized to receive either a control diet, which would be like the average of the top 10 selling grocery store brands type of nutrient profile, versus the Hill's Prescription Diet, JD. And those dogs, and they were evaluated by force plate, so actually measuring the amount of weight they were willing to put onto their affected limb. And those dogs that were randomized to receive the JD were 7 times more likely to improve over this 90-day period than the dogs that were in the control group. 7 times more likely to improve than the dogs that were in the control group, just by feeding them this food. You are going to dramatically change the clinical signs in dogs suffering with osteoarthritis. And that's great. It's always wonderful to have that kind of solid evidence. It's very objective and important from the greater scope. But if I could show that, but owners didn't see a difference when they fed the food at home, how long is the owner going to continue to purchase that food from you? Probably not another bag, right? Probably not. If they're not seeing a difference at home, you're probably not going to get them to repurchase and continue that therapy. So this study was designed in 127 animals in real homes with typical owners, randomized to receive either the JD or a control food, and then owners and veterinarians evaluated the dogs using subjective criteria. And the important thing here is that there were statistical differences, and owners were noticing that the dogs that got the JD were significantly better able, more anxious to play and to rise from rest, things that are important to owners. So we've talked before, particularly like regular exercise. Owners, even if you've told them that regular exercise is important, if they look at their dog, I mean, think about it. If your dog is laying there and it's so hard for them to get up and it looks like it's really not any fun for them to do that, they're probably not going to take your recommendation as seriously and force that dog, even though it would be good for them, to force their dog to go out and do something. But if the dog willingly gets up, then they're more likely to take that recommendation and actually act upon it. So this was an important finding, that owners are actually seeing that difference as well. Multimodal approaches to managing osteoarthritis are, in my opinion, too, the best way, and they are necessary. It's a necessary way of managing these patients. So the fourth study that was done actually looked at that. What is the effect of feeding a therapeutic food enriched with omega-3 fatty acids and other components on the dose of NSAIDs in dogs that are currently being managed, their arthritis was currently being managed with a non-steroidal anti-inflammatory drug. And so what they found, they standardized the dose of carprofen. These dogs were all put on carprofen, standardized that dose, randomized them to receive either the JD or that control food, again, that average top 10 selling grocery store brands. And then monitored their clinical signs and adjusted the dose accordingly. A couple of things that came out of this study that I think are important, and one of them is that even the dogs that were on the control food, they all started at the label recommended dose, and many of those dogs were able to decrease that dose from the label recommended dose, even though they weren't getting anything else other than in their regimen. So I think that's important to understand, that titrating your dose of NSAIDs is important for all of your patients. But what was interesting is that the dogs that were fed, that were randomized to receive the JD, were able to more rapidly decrease their nonsteroidal dose based on owner and veterinary assessment of their pains, and they were able, the amount they were able to decrease the dose, the magnitude that they were able to decrease the dose was greater in that group than it was in the dogs that were on the control food. So on average, the dogs that were eating JD, they were able to decrease their NSAID dose by 25% of the starting dose. And so that's a good thing, particularly if you're talking about long-term management of nonsteroidal anti-inflammatory drugs, because that could, both cost-wise and potentially for the side effects, be a benefit to both the owner and to the dog. So those are the 4 studies which and I'm really proud as a former Hills employee that we have that level of evidence, that amount of studies and that level of evidence to actually support the use of a nutritional intervention for the long-term management of osteoarthritis. Well, we've been sort of talking about these dogs like Gabby, who we saw initially, who was a normal body condition. But what about Molly? I mean, I would agree with several of the speakers early. The Gabbies of this world are fewer and fewer and further between. We don't see that many Gabbies anymore. Mostly we see the Mollys of the world. In fact, now that I go to the dog park all the time, when I look around the dog park even, and these are, you think about it, the dog park dogs, they're the active dogs. They're the lucky dogs. They're the dogs that are actually getting out and doing something. And even those, and even though I live in Colorado where we're supposed to be so active and et cetera, even most of those are more like Molly. And I don't know how that jumped ahead. But here's Molly. She's overweight. She's actually been started on a weight loss program. She's lost some weight. But this is her initial evaluation. I want you to look at this because unlike Gabby, she's not obviously lame, right? She does have radiographic changes that document that she does have osteoarthritis. But if you looked at this just was all the information you had, you might not be that excited about worrying that she has osteoarthritis. And I want you to keep this in your mind when you get to see her after photo, because this is a good example of why talking to the owners is so important, because the owners were talking about changes in her behavior. You may not notice this in the evaluation that you did, but the owners are talking about her not being the same dog that she used to be, not doing the same things that she used to be. So Molly is fortunate because she got to participate in the in-clinic feeding experience for the Metabolic Plus Mobility. And that's exciting for Molly because, as we pointed out over and over, the number of dogs that are both arthritic and overweight is increasing and increasing. I mean, depends on what studies you look at, but certainly about 40% of dogs that are overweight or are arthritic are also overweight, and that number is probably probably the low end of the spectrum rather than a true representation of that. When you see a patient like Molly, what's the first thing that you do? What are you going to recommend? Are you going to recommend weight loss? Or are you going to recommend nutritional intervention with, so it depends on the case. I figured that would be a large part of them, weight. And I would agree that weight, if you had to choose one, I probably would choose weight. To me, the overwhelming evidence for the benefits of weight loss in these patients is substantial. I mean, in human medicine, even just about 5 to 10% of weight loss, and people who have osteoarthritis that are overweight can lose 5 to 10% of body weight, and they will have improvements even in non-weight-bearing joints. So they will have improvements in function and mobility and pain scores, even in hands, which obviously, unless you work for Cirque du Soleil and you spend a lot of time on your hands, are probably not a weight-bearing joint. So it is a very important aspect. But then I just told you that we have really strong evidence for why intervening with JD and a disease-modifying therapy that can help not only improve pain management, but also slow the progression of the disease. So what's exciting to me now is that, well, and I guess my other point being that even if you do choose weight loss, it's not going to happen overnight. Even with the best therapeutic weight loss plan, it's going to be a relatively slow process. And during that entire time that you're affecting the weight loss, you're going to have continued damage to the joint, loss of that matrix, and as we've said before, once you lose that matrix, you're not going to be able to get it back. We also know that even before dogs have clinical signs, overweight dogs have increased biomarkers for damage in their cartilage. So we've mentioned this earlier that obesity puts abnormal stresses on normal joints, but certainly also on joints that may have any type of instability. So even long before you see those clinical signs, there are biomarkers that indicate there is something going on at the level of the joint. There have also been gait studies looked at overweight dogs, actually specifically looking at abnormalities in their gait, and even in the absence of obvious clinical signs of osteoarthritis, overweight and obese dogs have shortened range of motion and increased peak vertical forces. So there are abnormalities that are abusive, if you will, to the joints going on long before you see the clinical signs. That's why it's so exciting to me that now you don't have to choose between these two very important therapies. The introduction of metabolic plus mobility really gives you an opportunity to do both of these things at the same time. You can have an effective weight management program along with the benefits of disease-modifying and anti-inflammatory effects of the JD. So Molly, actually, as I mentioned earlier, was fortunate enough to be part of the in-clinic feeding experience for the launch of Metabolic Plus Mobility. So her veterinarian made a specific nutritional recommendation for her to continue on, or to start on the, continue her weight loss plan on Metabolic Plus Mobility. And this is her 3 months later. She's lost an additional 12 pounds. You can see she looks a whole lot better. The owners describe her as really a different dog. Now this is the playful, happy dog that they know and love, who is very happy and willing to go on those walks involved in the exercise program that should be part of her. And now look at this video. I want you to see the difference. Before, it looked like she was just scared of walking on that floor. She was painful. She didn't want to walk on that floor because it hurt. Watch this one, because she's going to zoom by and you almost miss her. Like, whoa, where'd she go? That's the happy dog that she wants to be. Think about that first video. She wasn't obviously lame. She wasn't bunny hopping up the stairs. She was just timid and taking really careful steps on that floor because she didn't want to go have a misstep, because she knew it was going to hurt if she had to catch her balance on one of her painful legs. So that's the kind of dog that is going to follow your recommendations for physical rehabilitation, that's going to follow the recommendations for being better about her rehab and walking and regular exercise. So very exciting to see that. I think it's just, it's a great time to be practicing veterinary medicine right now, because there's so many things that we can do now that we couldn't do even just a few years ago. And I think this counts among those things, of all of the things that are exciting and are changing and are new, diagnostics and et cetera. But being able to have a clinically proven product that can both have effective weight loss and improve mobility in these overweight arthritic dogs, to me, is very, very exciting. And I hope what you take home from this is that when you're starting, when you see even animals that are just are not yet clinical for their osteoarthritis, but are at risk for it. You're having those conversations about weight management, but you're thinking about intervention with nutritional therapy early rather than late. Because you have all of these choices now, you can customize your specific nutritional recommendation no matter what the circumstances. So that it depends that you said earlier, you've got an answer for whatever that is that's in front of you that you can help improve the quality and quantity of their life. And with that, I'm done.
Excellent. Woo! And I definitely have to give Todd a major compliment because her timer was still on 15 minutes just because a little glitch in the back, and I told him, you know, she needs to cut it. So it went from 15 to 1 minute, and still she finished in time. So you are amazing. Amazing.
I was actually worried. I was like, I don't have 15 minutes more worth of
exactly,
stuff.
Exactly. I probably should have just let it go.
I would have started dancing again.
I like it. All right, questions. Just before the break, questions. Yes, there's one.
So I have a patient next week who I'm hoping to start on the metabolic mobility combo diet. She's kind of like Molly.
What a good choice. Yay! Excellent.
She's kind of like Molly in that we can't ever isolate a painful joint, but at home she's not herself, blah, 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 she's overweight. How long should I tell them to stick with the diet before they, quote unquote, give up on it?
So the key to that would be to managing expectations. And so first thing I would say is that you want to set up realistic expectations for the weight loss. So, you should expect about 1% of body weight per week, and so you want to actually sort of calculate what that would be and set those expectations. Check, depending on the owner, at either 2 to 4 week intervals, whatever works for your schedule in there. I would say to them that for her, they need to go long enough for her to have lost between 6 to 10% of her body weight. We saw that in those other studies, losing about 6 to 8% of body weight will have a dramatic effect on animals, measurable effect, at least in the studies. And so the 3 week for improvement in mobility, you may see it as early as that, but I guess I would want them to stick with the weight management part of that longer. So, I might tell them that, you may see some improvement in clinical signs just from the effects of the JD in as little as 3 to 4 weeks. But let's plan on sticking with this, making our final assessment until we've got at least about 6 to 8% of body weight loss, and then decide where we are.
All right. Any other questions? We still have 2.5 minutes.
I don't really want to have to dance.
In time. She doesn't want to dance. Come on. Or maybe we should make a dance. There we are. And there's Heather again.
So Heather's training for a triathlon. This is good, right?
Exactly.
Yeah.
Is the metabolic plus mobility as effective as metabolic for losing weight?
So I think the answer to that's probably yes. I mean, it hadn't been out there as long, but yeah, I don't. The things I've heard about the in-clinic feeding experiences, based on that, my answer would be yes.
Any other? Yep, we have a question right here. Perfect.
I use metabolic. I'm in Mexico, and I've seen a problem with the owners that they feel the dog is always hungry, or the cat, and some owners quit the diet even though they know the importance for the pet to lose weight. Is this also happening with the metabolic and movement?
So that can happen with any food, and I'll say a couple of things about that. And one of them is that many times owners misinterpret the behaviors of the animals, and they are interpreting them as being hunger, that they're hungry, that they're food seeking, when oftentimes what they're really doing is attention seeking. And we have simply trained them, because what happens when your dog comes up to you, or your cat comes up to you and does something incredibly cute, or you know, acts a certain way, oftentimes we reward them with food, either a treat or their meal. Dogs are incredibly smart, cats too. They figure that out, and they're like, hey, if I go up here and do this cute little thing, they're going to think I'm hungry, they're going to feed me. It's a win-win situation. So one of the things I always say when you're starting a weight management program is to counsel owners about those behaviors. There's also a thing called extinction behaviors. If I've always gotten a treat when I did this before, and you suddenly stop doing that, well, I must be doing it wrong, so I'm going to do it harder and better and longer and you know. So they're going to actually try harder to get you to do whatever that was you were doing. So you have to counsel owners a little bit on that too, so that they understand there may be this transition. The flip side of that would be, if you really can't manage that, to go back to a higher dose of food and decrease that dose more gradually, so it's not such a big change for both the owner and the animal. Oftentimes more for the owner than for the animal, but you got to weight management is a disease of people as much as the pet, so you got to manage both of those.
Excellent.
Now
Thank
I'm
you
over time.
so much. This is save your questions for the roundtable, please, and thank you again, Paul.
Thank you. Thanks.
Excellent, excellent, excellent.